Good afternoon, everybody. Welcome to the National Autism Trainer Programme, to this information session for our new strand for health and justice settings. It's great to have you today. Hannah is going to help me with the slides, so if we can go to the next slide, please. For the next 2 hours, we are going to listen from many different speakers. First, I will start with a warm welcome and few housekeeping notes. Then we're going to look together at why this training is needed, why the National Autism Training Programme that is focusing on autistic mental health and staff well-being is needed in health and justice services. You're going to hear from members of our team about why and how we're framing our work, why professionals see the need for a different approach and what are their hopes for improving the workforce. We're going to have a short break at 1:45, and then we're going to come back to talk about practicalities of the training, how you can join the training, what does it mean, the trainer model, as well as what support you get after the training, such as specialist days, community of practice support, and so on. We will also have time to take your own questions and to answer them. We will have a Q&A session. If we go to the next slide, please. I'll start with some housekeeping notes. This webinar will be recorded and it will be made available after the event, along with all the slides and the videos that you're going to see today. We will also upload on the Anna Freud webpage this video, and you will have free access. After the event, we will collect all of your questions, the ones we answered live, but also perhaps those that we were not able to answer live. And we're going to send you an FAQ document with all the answers so that you can hold all the information. As you might have noticed already, throughout the information session today, we have British Sign Language interpreters throughout the event, along with closed captions for you to use. Please note that your video, microphone, raised hand function, and chat are switched off for the duration of the webinar. Please do submit any questions you might have using the Q&A feature, which you can find at the bottom of the screen, and we will do our best to answer your questions during the question and answer panel discussion. As I said earlier, we will also have a break at approximately 1:45 for 10 minutes. Okay, next slide, please. A very, very warm welcome. We're really excited to be supported by the National Health System England, NHS England, to start this strand. On behalf of myself, Georgia, and Dr. Ruth Moyse, a very, very warm welcome. And if we go to the next slide, please, a little bit about Anna Freud and our mission. Our mission here at Anna Freud is to close the gap in well-being and mental health by advancing, translating, delivering, and sharing the best science and practice with everyone who impacts the lives of children and families. We are excited to be the key providers for the National Autism Trainer Programme. The programme is commissioned, as I said, by NHS England in partnership with Anna Freud and AT-Autism. You will have a chance to meet the co-director, Dr. Ruth Moyse, later during the Q&A. We aim to work together in partnership to support NHS staff in providing care to diagnosed or undiagnosed autistic people. Next slide, please. This is a Train the Trainer programme, and it sits in the Education and Training Division at Anna Freud. Our curriculum is fully co-produced with and co-delivered by over 60 autistic people. It is underpinned by valuing both the well-being of the autistic person and the staff members. Across the leadership team, people are neurodivergent. There is a very, very strong emphasis on privileging neurodivergent voices and understanding well-being for all, for autistic people and the staff members. The National Autism Trainer Programme promotes an experience-sensitive, trauma-informed approach and is being delivered nationally across all ages, inpatient, community mental health settings, health and justice settings, as well as residential special schools and colleges. Next slide, please. It is really at the heart of the program to work with rather than on or for autistic people. This is something that we're in a really good position to model to the services and to the workforce who are training due to our partnership with AT-Autism. Our partnership successfully started in 2021 when we started the delivery of a pilot program back then for inpatient services. The program received excellent feedback on approach, quality, and impact from delegates, commissioners, the autistic community alike. We continue working together with AT-Autism in an equitable partnership across all stages of the National Autism Trainer Programme. We also have very, very strong links with the wider autistic community. We work with autistic people of all ages, all genders, all professions who audit, co-produce, co-deliver all aspects of the curriculum. I would like to particularly mention a Second Voice, an organization that is really supporting us to work with people from global majority and to understand the intersections of autism, well-being, and ethnicity. Next slide, please. There are many, many reasons on why autistic people's lives are failed. There are many failings on how we understand and we support people in schools, in statutory services, in community mental health services, and the criminal justice system. Of course, our training is also celebrating the very good work that many of your colleagues are doing in different services. It's all about coming together, exchanging practice, understanding and removing barriers, and improving outcomes for diagnosed and undiagnosed autistic people. One of our content developers, Alexis Quinn, an autistic person who has survived restraining, seclusion, and has come across many different difficulties in the community settings, is giving us a flavor of the picture. What is it like to be autistic with mental health needs in the current times in this system?
Sometimes autistic people will need access to community mental health services. I needed help when my brother died. I couldn't sleep. I was more sensitive to touch, light, and sounds. And I found I needed to move all the time. Now, because my brother's death didn't make sense, I spent time researching death processes. People became worried. I went to the GP. I went to mental health services. I tried to get some support. I guess there I was expecting to find a place where I could share my experience, concerns, and distress and feel validated, I guess. But it was hard to make an appointment. You know, I phoned up, it's like press 1 for this, 2 for that, 3 for that. When I did get an appointment, you know, it was like, say at 1 o'clock, you know, the person was late, the waiting area was noisy. I became like really overloaded. People were like staring at me. The receptionist was telling me to sit down. They were threatening me that if I didn't sit down, I'd have to leave. And I guess I was trying to explain that I needed, to move to like a quieter space. But I was so overwhelmed that I couldn't get the words out. On one occasion, the police were called. I was quite stuck. I couldn't move from sort of being overwhelmed. I was in sort of a shutdown. And when the doctor did come, it was too late, right? And I couldn't communicate at all. They thought, because of the way that I was presenting in this kind of overloaded state or this sort of a shutdown, that I had a mental illness. The doctor was sort of writing down I was agitated, intolerant of others, that I had a deficit in communication, I had rigid obsessive thinking. And I was just thinking to myself, if staff had supported me in the ways that I'd needed, I could have explained my interests, why I was moving, why I was acting in the ways that they found difficult to tolerate. But instead, I was misunderstood and I was sectioned for assessment. So here, we can see my autistic reaction, to the hospital environment meant that I was there for years. And we know that autistic people stay, don't we, for an average of 6 years, compared to 9 days for a typically developing person. But it doesn't have to be this way. When we understand autistic people, when we can make reasonable adjustments, for example, offering an appointment in the morning when it's less busy, when staff can be on time, when we reduce overload in settings, when we just simply create a space, right? Maybe a double appointment where people can feel less anxious, where they can have time to process information. And that will help you, hear the context and reasons for distress. It can make such a difference, when we're accepted, validated, honoured, when we take the time to listen, to build trust, to be empathic, and to use language and build relationships in neuro-affirming ways, because these are the things to good community care. These are the things that keep people out of hospital.
Throughout our 4 days of training, delegates will have a chance to look at many more personal accounts in the form of animation or interview videos. Every single slide, every single video has been authored or co-authored with autistic people, and in some cases with their parents, carers, or siblings. There is a lot to be said about the preventative support that is needed as well when we think about health and justice environments. The average age range for early concerns for both autistic adults and parents and their carers is approximately between the ages of 13 and 15. In a recent national report, 75% of autistic adults and 86% of parents' carers reported that they have been visited at least once by the police. Some of the top early concerns for parents and carers and professionals who work with young people were being easily led, that the young people might be easily led or influenced by peers, violence or aggression towards others, damaging property or fire setting, and being excluded from school. During our training, we talk a lot about the circles of victimization, exclusion that autistic people might be suffering, as well as the social determinants of mental health. Next slide, please. We currently know very little about how neurodivergent people go through a system which is only designed for users who are just like the people who run it. It has all these unwritten rules, all these systems, but that might not be understood or might be misunderstood. One of the key aspects is the late diagnosis or no diagnosis of autistic people with or without co-occurring conditions such as a learning disability, epilepsy, ADHD, and so on. So late diagnosis or no diagnosis at any stage within the criminal justice system is a significant failure, because without proper assessment, service users may not receive the support that they need. This might be basic adjustments, for example, explaining essential documents or explaining court processes and proceedings. Autistic people, diagnosed and undiagnosed autistic people, have been telling us during the period of curating this material that they feel ignored, stigmatized, they feel lost, and they find it very, very difficult to understand what they're supposed to do and how to survive that system. There is a significant gap in understanding support needs through all sections of the system, from police involvement to probation and young offenders institution or prisons, as well as for those who are at risk of entering these institutions and that system. Next slide, please. In the next session, we're going to hear from very good colleagues and funders about why this training is needed. First, we're going to hear from Professor Peter Fonagy. Peter Fonagy is the Chief Executive Officer at Anna Freud Center. He is a visiting professor at Yale and other universities. He is also the head of department at University College London, the Faculty of Brain Sciences. Peter has been chairing many committees around children's and young people's mental health, and he has been involved in NICE guidelines. Let's hear from Peter his message about the National Autism Trainer Programme.
Good morning. I'm Peter Fonagy, and I have the privilege of being the Chief Executive of the Anna Freud Center. I'm delighted to be introducing this training program this morning, a training program that we are enormously proud of actually beginning to deliver. Why is this training needed? The training, I believe, is needed to radically alter the experience of autistic people in all the services they come into contact with, because we have had so many reports of less than adequate care. What we hope it will achieve is enabling staff across all age, mental health, secure and residential settings and youth justice provisions to have a much better understanding of the needs of autistic people and adjust their approaches in response, which will enable better care. I think it's important to underscore that it's not just about understanding, but what we hope is going to create a change that's desperately needed, a change in the way professionals behave when they encounter autistic people. It's a training that has been completely co-produced and is co-delivered, ensuring that autistic people are central to every aspect of the training that we offer. The training fits with the centre's strategy, the strategy that we call Closing the Gap. The National Autism Trainer Programme is a key part of us being able to close the gap, by which we mean to improve the knowledge, the skills and the confidence of professionals, and in fact all those working with children and young people in whatever capacity across the United Kingdom, who are involved in delivering or potentially delivering mental well-being support. We want to achieve this at scale. We want to change the narrative about children and young people's mental health. The National Autism Trainer Programme is a great example of how we can achieve this. We can do so with innovative approaches, drawing on the expertise of people with lived experience and adopting a train-the-trainer model. So the National Autism and Trainer Programme is a core part and a good illustration of what we hope to achieve in our Closing the Gap strategy at the Anna Freud Centre. And with that, thank you very much for listening. And I hope that today's events will justify my confidence in the programme to deliver a key part of our mission at the Centre. Thank you.
The National Autism Trainer Programme is co-produced, co-delivered, co-designed with autistic people and promotes an experience-sensitive, trauma-informed approach. You don't need to have specialist or high-level skills in order to attend the course. You need to be committed to promote autistic well-being, staff well-being, and be an agent of change. Bring change to your teams. We are here to support you to grow your training competencies and also to train new and existing colleagues in your service. It is a great pleasure to have with us Hasan Wazir, Senior Program Manager at NHS England, who is representing our funders and is going to talk to us about his view and the funders' view about why the program is needed. Over to you, Hasan.
Thanks, Georgia. Good afternoon, everyone. Yes, Hasan Wazir, Program Manager with the National Learning Disability and Autism team at NHS England, and more specifically within the Workforce Training and Education Directorate. We've got a number of major national programs taking place at the moment, And right alongside the Oliver McGowan program, which I'm sure you guys would have heard of as well, we've got the National Autism Trainer Programme as a key area of focus for us. And I've been fortunate to be involved from the inception of this programme, really. The work really started back in 2019 off the back of several Care Quality Commission reports around the failings within children and young people mental health inpatient provisions and settings. And a lot of the recommendations pointed back to the fact consistently that there was a lack of training, autism training specifically for staff in those settings. At that point, I knew that there was going to be some mandatory training that was going to be developed, but that was going to be a few years down the line. And we needed to do something fairly quickly and now, and more specifically for the CAM settings, the children and young people mental health inpatient provisions. So we held a big stakeholder event with service providers, experts by experience, clinical directors, etc., to really understand what they wanted from this training and what we could deliver, whether they wanted us to go and commission someone to deliver training for them, or whether they wanted a different approach, something more sustainable. And the feedback we had from the stakeholder event was they really wanted something that was more sustainable, something for local trainers in their services, rather than another organisation coming in and delivering training. They really wanted something that had co-production, co-design and co-delivery at the heart of the whole programme. They wanted to ensure that the materials that they were being then asked to deliver as part of the training were of high quality and standard, so they were appropriately quality assured as well. And they recognised that once we've trained trainers, too often we would then leave them to kind of go off and deliver training in their settings. But what they recognised was actually we needed a lot more support for these trainers post-training to help them deliver that training as well. There needs to be a flexible approach to the delivery because there's so many different teams working in so many different ways that we couldn't have a very structured program to say this is the only way you can deliver this program. Had to be flexible delivery that suited the environment and the settings as well. And as that last point says, it has to fit towards a service setting as well. So not general training, but something more specific to the areas that those staff members would be encountering on a day-to-day basis or so. Next slide, please, Hannah. Thanks. So the initial scope was around child and adolescent mental health services. This was then evaluated and the evaluation came out very strong. So then we were able to naturally then expand into the adult mental health inpatient settings. While we were working on the pilots within the adult mental health inpatient settings, there were calls for us to move into community settings, but we're constantly working within constraints of time frame and budgets, etc. And although they were part of our national workforce strategy, at that point in time, we were reluctant to spread the net too far and really concentrate on some areas and get them right before we start to work in other areas. But once we had the adult inpatient services training program evaluated, again, it came out very strong. So then we were able to really kind of expand our ambitions in terms of where we wanted to go with the program. We had some budget and we had the time frame to really kind of look at this program as a more of a holistic approach. So now the National Autism Trainer Programme is continuing the rollout within the inpatient mental health services. But we're also branching out into the mental health community settings as well, for obvious reasons with people transitioning between the two. So it makes a lot of sense for us to be working in those areas. And at the same time, because we were able to expand our ambitions in terms of how this program operates and where it operates, we're also working really closely with our colleagues in the Children and Young People's departments around NHS England. And it made a lot of sense for us to then roll the program out, within residential special schools and colleges, and then within the health and justice settings as well. Next slide, please, Anna. Thanks. So yeah, we're really, really excited, really happy to be working with Anna Freud and AT-Autism in developing the National Autism Trainer Programme. And we now feel that we've got a programme that actually will deliver the consistent messaging and understanding of languages, etc., across all the different settings, which is really key for those individuals that transition between those settings. It was really strong feedback that we wanted co-production, co-delivery, and we feel that we've really got this with the National Autism Trainer Programme through Anna Freud and AT-Autism as well. It's not a tick box exercise, as you've heard previously from Georgia, and you'll hear a little bit later on in the webinar as well around the co-delivery and co-production of the programme. We've got really good, strong support for individuals as well. So once a trainer has been trained, they've got support around communities of practice, some general support, and some more bespoke support where required as well. And really for us, as part of the commissioning team at NHS England, what we really wanted at the end point of this programme is for a culture change, for the training to become business as usual. So once we can pull away the funding, the training naturally starts to take place again. So people are trained, trainers are training other trainers, and it continues to go forward as we're naturally speaking. So that's a very quick summary of where the National Autism Trainer Programme came from and where it aims to go. And I'll hand back over now to Georgia. Thank you.
Thank you so much, Hasan. So critically, our program is designed to be a model that all of you can take back to your own health and justice services, to your trusts, in order to facilitate the training that you're doing with your own colleagues with our support. Our training will help you, your staff to address perceptions and enhance your understanding and your staff's understanding of autistic people's needs. You will be able to gain insights into autism from a content completely designed by autistic people, some of whom are autistic academics, many of whom have personal lived experience of ineffective care and interacting with justice and care systems. Our training model goes beyond knowledge transfer. We aim to facilitate opportunities for staff to share vulnerabilities and concerns and to reframe how they understand the impact of their own behavior in how they respond to autistic people, particularly in points of crisis. Next, we're going to Scarlett Milward. We're excited to have Scarlett with us today. She's the program manager at the National Children and Young People's team for NHS England. Over to you, Scarlett.
Thank you, Georgia, and thank you very much for having me here today. I don't have huge amounts to say, ordinarily I do, but I think a lot's been said already. But fundamentally, thank you for all being here. And so I work really, really closely with the National Children and Young People Health and Justice team. Some of you may know Andrew Clark-Nichols, who sadly isn't able to be here today. And we have worked really, really closely over the last sort of 3 years to maintain a focus of autistic children and children with learning disability across the health and justice work, but equally their work absolutely informs some of our work, particularly around key working, dynamic support registers and care education and treatment reviews, as well as other community provision. But over the last 3 years, we've been collaborating to really, really increase awareness and identification of neurodiverse kids across the health and justice setting. And that really is to support our long-term plan commitments, which are around giving children a better start in life by accessing the best support to live the life that they choose and provide additional support for children with complex unmet needs who are high risk, high harm, or potentially highly vulnerable. Next slide, please. I think that's gone on. Yes. So as part of this work and this free training offer, it's really aimed at giving you and your colleagues new skills and a greater understanding of autistic children, diagnosed or undiagnosed, to make sure that their additional needs are met, and really to give confidence to your workforce and our colleagues in understanding our young people, and so that our young people can get the life that they choose to live. So that's it from me. Thank you for being here. Any questions? Very, very welcome. Welcome, and I'll do my best to answer in the absence of Andrew. So back to you, Georgia. Thank you.
Thank you so much, Scarlett. So significantly, our model is recognizing the importance of staff well-being in providing the best care, as well as the well-being of the autistic people you're working with. This is fundamental. And in order to achieve that, we need to change the culture. We need to remove inappropriate or restrictive practices and to support an experience-sensitive and relational approach to care. Our aim is improved care outcomes and satisfaction for all. Alexis Quinn is an autistic survivor, author of many books, and the manager for Restraint Reduction Network. She's going to talk to us today about the different types of restraint that autistic people may be suffering. We do know from research that autistic people with or without learning disability have many times, many more chances to be restrained or secluded. Now, if you add intersections, if you're autistic and Black, autistic and Asian, autistic and trans, autistic and gay, all these intersections, they're just maximizing the potential to be excluded, the potential not to be treated right. We want to change that, and we do offer a safe space for professionals to reflect and to grow. Over to Alexis.
Hi, my name's Alexis Quinn, and I'm going to talk to you about, what it's like, I guess, to be restrained in your formative years at school and the kind of the impact that has. So, I can attest, first of all, to its long-term harms. But I suppose to understand these, we need to look at the full breadth of restraint practices that schools employ, which a lot of them actually go under the radar. They were sort of like just part of the system, part of the school, they're kind of embedded. So the first one is the kind of cultural restraint. So by this, I'm talking about the ways that schools promote a neuronormative meta-narrative. So here we're talking about culturally preferred ways of being. And I suppose that non-autistic cognition is superior to autistic cognition, which is often seen as kind of disordered and faulty. There's something wrong with you is kind of the message that you get. So school teachers would often stop me from expressing my culturally preferred ways of being, stopping me from doing things that were important to me, and I suppose my autistic culture, things like making eye contact, things like, being super engrossed in special interacts, things like needing to move and not being kind of having to sort of sit still. And when I would do those things, when I would embrace my kind of culture, I was often made to sort of feel ashamed of myself or feel inferior. Sometimes I'd be humiliated because, I was very different to the others in my class. So what would often happen is that psychological restraint would be employed. Okay, so what we're talking about here is putting psychological pressure on somebody so they feel that they've got no choice to comply. So maybe threatening me with detention if I moved too much or was disruptive, not putting my hand up in the class, threatened with being removed from the class or having learning support team come down to the classroom. Often they would come in numbers so that I knew that if I didn't move by choice, that actually I'd be forcibly removed. Or maybe even making me do additional work to make up for what I had been forced to miss in the classroom. And even stuff like just shaming me like in front of the class, like, oh, look at Alexis, And also embedded in schools, in school policies, there are another type of restraint called blanket restrictions. So this is where a rule is applied to a group of people, regardless of individuals' needs. So, for example, everyone has to sit at a desk for X amount of time. If you miss your homework, X, Y, and Z will happen. No one can access the toilet at break or lunch, etc. If you shout out, X will happen. So these kind of restrictions, these kind of restraints actually disproportionately impact people like me because they target our very kind of ways of being. So what's the impact of this? Well, first of all, it undermines trust. Okay, it undermines trust between me and the teacher, me and other people, because I'm constantly feeling objectified, right? That damages my self-esteem, right? It causes me emotional harm. I feel guilty. I feel ashamed. I feel blamed for just being me. And it actually stops me being a full person because I'm constantly having to restrict the way that I am. I'm constantly having to hide parts of myself. So that obviously leads to poor learning outcomes, okay, and probably, for many people, exam results. Certainly, my last few years of school, I attended only about 50-60% of the time. And it wasn't because I'm not intelligent. I actually ended up with straight A's, but it was just because I just wasn't welcome. It also, and this is important, it causes complex trauma This is these moment by moments, micro accruals of little niggly traumas that kind of chip away at your protective shield until it's completely, smashed to smithereens. And so you kind of avoid interacting with people. You become really insular because of the stigma that it creates. There's no evidence that any of these types of restraint, psychological restraint, cultural restraint, blanket restrictions, result in any kind of good outcome or social benefit. We know that they affect people's ability to connect, to trust, to make decisions, to make improvements. But actually, if we respect people's views, and avoid putting psychological pressure on them, we know that it supports people to make decisions. It helps them to develop their self-esteem, to improve their decision-making, and actually to become more autonomous. Now, with regard to physical restraint, right, mechanical restraint, environmental restraint. So I'm talking about being, environmental restraint. I'm talking about I was often put in isolation booths, that kind of thing. Yeah, not even an hour goes past before I think about that stuff that happened to me, right? The fight, the sweat, the immense fear, wetting myself, the hands on me, the bruises, the utter desperation, the isolation, and the fact that there's no one to rescue me, because actually I deserve being in handcuffs. I deserve being put in isolation booths. I deserve having, 10 people all over me. I have a hole. I often describe myself as having a hole in my soul. A big gap in my self-esteem, in my ability to connect, to trust, to feel any amount of acceptance for myself or feel any respect for myself. Because, I think in those formative years, you're kind of taught to hate yourself. You're scared to embrace your natural sort of inclinations. You struggle to build relationships. And all of this as an adult has led to sort of a lot of interpersonal damage, including abandonment, emotional regulation, difficulties, loss, as I said, mistrust of others, and frustrating my natural need, my human need for kind of connection and support. I remember battling with teachers, feeling punished, unheard, uncared for, and totally unable to do anything about it because I couldn't change myself. I couldn't change the way that I am. And I admit, actually, that I have a distrust for practitioners now, for those representing, the system, and express at times a hopelessness. I'm definitely sometimes feel hopeless about positive systemic change. But I would say to you that if you want to help, you need to consider and acknowledge and understand the trauma of restraint, all sorts of restraint, and its potential impact, long-term impact on individuals, classroom dynamics, inequalities, and well-being. Thank you.
It's very interesting and very painful to hear from Alexis, who is an autistic survivor. And of course, talking about her early years and the school times is building the picture and is helping us to understand that the autistic people that you will be working with are very likely to have been victimized from a very young age. There is painful data from UK research that is showing us that by the age of 5, autistic people, diagnosed or undiagnosed, have seen their parents grieving about their behavior, have been bullied from a very, very young age, have been excluded from school, have seen others worrying about what is wrong about them. On the National Autism Trainer Programme, you will gain an understanding of autistic mental health and barriers experienced by autistic people. You will hear of and discuss examples of existing good practices, innovative approaches of working with rather than on or for autistic individuals, including how to reduce restrictive practice. What is it getting in the way so that professionals are getting scared, are getting burned out, and have to use these practices? Next, we're going to hear from another content developer, Lauren Fernandez. Lauren is very active into supporting our program on her experiences of restraint and not having appropriate care in the community, which led into her being in contact with criminal justice system. Over to Lauren.
For me, the lack of community support began long before I received my diagnosis in 2018. Since 1995, my mum had requested and fought to be supported with me and my challenges. Back then, very little was known or published about autism, even less regarding girls and non-white people with traits of autism. This meant that I did not fit into any criteria professionals used, and therefore there was no suitable support offered to me or my family. When I was finally diagnosed, aged 26, I asked for therapy and support to be told that there was little to none available for adults. I was referred to a social group in light of my diagnosis, which I attended. Unfortunately, I was the only person of colour and the only identifying female in the group. Concerns and themes discussed could not be further from my own reality, challenges that I had and continued to face. I felt further isolated and struggled to continue with work and my life as it was. Refused benefits and social care support. In addition to everything else going on, life became more and more challenging until one day I couldn't take any more. I was signed off work and spiraled into an anxious and depressed state. Being out of my usual work routine made me even more vulnerable than I already was. A victim of domestic violence, homelessness, harassment, and sexual assault, I was in contact with several services, yet none acknowledged my need to be looked at as a whole person. The intersections of the challenges I faced, paired with no support, saw both my mental and physical health decline drastically. I was then threatened with homelessness again by my local council. This directly led to me being misunderstood, apprehended by police, and sectioned under the Mental Health Act. Leading up to my hospitalisation, I spoke with my GP several times regarding the physical manifestations of stress within my body. I fought with my borough and a housing officer I'd never met, asking why I was being denied support, given how vulnerable I clearly was. I searched for legal support, which I couldn't afford, and in the end, my GP advised me to call the crisis line out of hours. I was unaware that this was for mental health, but when I called, they quickly identified that I was in need of social support and not psychological. I was referred to the home treatment team, who prescribed me antipsychotic and sedative medicines. Even though I was against taking medications, stating that my increasing social problems would not disappear and I would not be able to rest or focus on anything else until I had found resolution. When that same nurse visited me at home days later to find that I had not taken the prescribed medicines, she wrote that I was labile in mood and that I challenged her. The challenge was when I asked her what she would do and how she would react if she was in my position, facing homelessness again after all the things I had recently gone through. I had encountered the police the day before her visit, when 4 officers wrestled me into handcuffs and transported me to a safe space. That was an observation suite at the local hospital. The sole purpose there was to see that I would comply with the doctor's wishes and take an unpackaged, unidentifiable drug. I know this because I refused for hours until they threatened me with a syringe. When I finally took the drug, I was allowed to walk out within 15 minutes and was home shortly after. 2 days later, I was apprehended by police again and then tricked onto a psychiatric ward, where the doctor attempted to give me a diagnosis of bipolar disorder upon my first ward round with them. I wish that staff would have listened to me and involved me in decisions around my care, instead of reading notes from situations I had been antagonised and provoked in. I advised of my needs and how they were being ignored and my challenges exacerbated. I requested appropriate therapy for years leading up to my hospitalisation. In place of forcing drugs into my body, they should have taken a multi-agency approach to see the whole picture and to help. They could have put in place an interim care plan and supported me back to independence instead of hinder and scar me. Finally, I wish I was never restrained and that the police were never involved. They escalated the dynamic, even by their own admissions.
We are excited to pilot the first round of Health and Justice National Autism Trainer Programme Strand on the 27th of November. You will be trained for 4 days, one day per week for 4 weeks. And you will hear more a bit later about how the program works, how you get qualified, and so on. When it comes to our training, we seek to inform practice through an examination of perceptions of autism. We probably are a little bit different from many established or traditional courses where autistic people are not actively involved, and the major focus is on the clinical features of autism and how these are responded to. During the training, and as we talk right now, our production team is creating material for the pilot. We offer practical insights, practical strategies drawn from autistic people and people who work in health and justice places. And what does it mean? Sometimes it's the buzzword to say neurodiversity friendly or autism friendly or trauma informed. It's exciting to have with us today Tristan Klaubenscheidel, who is an autistic trainer, one of our many autistic trainers, and is going to talk about how we can frame our work at the National Autism Trainer Programme. What do we mean when we say that we want to model collaborative, experience-sensitive and trauma-informed approaches? Over to you, Tristan.
Lovely. Thank you, Georgia. Appreciate it. Good afternoon, everybody. Really pleased to be asked to talk to you today. My name's Tristan Klaubenscheidel. Very good try, Georgia. And I'm one of the autistic core trainers for the programme. I currently deliver the CAMS community setting programme and the children's and young persons inpatient setting programme as well. And I've been doing that since March this year. So I wanted to tell you a little bit about how we frame our work, our training, using the collaborative, experience-sensitive and trauma-informed approaches. So a key aim of the programme is to foster respect in differences of neurodivergent people. And the programme reframes the negative and the often limiting perceptions of the autistic community. And it puts the autistic voices at the heart of the programme, with delegates engaging, exploring, and amplifying the narratives of autistic people in a safe space where they can do that. All of the materials, as you've heard in the programme, have been made in a truly collaborative way with autistic people, working together with neurodivergent team members and other allies as well. Next slide, please. Collaborative practice, again, is at the heart of what we do. It's got to be, not only with the co-production, but also with the co-delivery of the course by a neurodivergent person. Our values and approaches are simple, really, and they encompass curiosity, compassion and care, relationships, trust and respect. And every part of the process has been owned and shaped by a real partnership of equals, including respect for skills, expertise, and adapting the best ways of working with autistic people and other neurodivergent team members as well. Next slide, please. So the collaborative team includes real accounts and lived experiences from those who have experiences in inpatient and outpatient care, and from parents and carers of neurodivergent people, and from neurodivergent academics as well. And as I've mentioned, co-delivery, delegates are trained by a partnership of autistic and non-autistic experts and facilitators with lived experiences, and by other neurodivergent experts by science and academics as well. So the delegates join as experts within their own services, and will have reflective activities as well as discussions and learning to deepen their knowledge and help evoke that positive change that we're after. Next slide, please. And of course, there's ongoing support as well through the programme. So delegates will have access to a bespoke e-library with various resources and articles and developments and research. And they'll be invited as well to join regular community of practice events and in those teams we'll get advice from each other, and they'll hear guest talks from autistic experts. There'll be shared learning experiences, events with expert guest speakers, and opportunities to discuss key areas and topics and share best practice that's already out there as well. And there's a lot of thought and planning and commitment that's been given to establishing the ongoing training and development and support, and the safety and the well-being to delegates and the EBE trainers as well who take part. Next slide, please. So during the programme, the delegates will be able to discuss and explore with facilitators a number of different dimensions of named frameworks, together with the practical use and applications of them as well. The NAP trainers will train NHS staff, who will then connect to our pool of experts by experienced trainers, who will then help them co-deliver back in their trusts, and will help add real value and context to the training by sharing their knowledge and their experiences. I've already mentioned the active community of practice to support staff to keep growing their skills, which is ongoing, and a link to that will be put in the chat box during this seminar. Next slide, please. So at the National Autistic Training Programme, mental well-being is paramount for everybody. And one of the approaches that we use is experience-sensitive approach. Autistic people are acknowledged and validated as the experts in their own experiences, and that expertise is valued, it's listened to, and it's responded to in a specific approach that is sensitive to those experiences. There's a shift in mindset and culture during the training, away from checklists of so-called fixable behaviours, to one of curiosity, relationships, trust building, and strengths. So meaningful engagement within clinical and educational environments. Next slide, please. Thank you. So let's touch on trauma. Research suggests that a majority of autistic people have diagnosable levels of post-traumatic stress. That's Rumble and others, 2020. And reasons for this are varied and maybe accumulative combinations of years of pain from sensory overwhelm, searing pain perhaps from medical interventions or restraints, neglect, enforcement of neurotypical behaviours using punishing procedures and pushed on autistic people sometimes, and bullying, isolation, sexual abuse, death or abandonment by a deeply loved one perhaps, and the accumulation of microaggressions. So because autistic people experience events very differently to non-autistic people, the same negative event can be traumatic for an autistic person, where it might have little impact on a non-autistic person and be dismissed or diminished or minimized or even ignored. Next slide, please. So a trauma-informed approach recognizes all of these things, and that distress behavior is an understandable response to trauma, and it's not something to be glossed over or diminished or hidden from view. Many are terrified of being restrained because of past traumas or memories, or from suffering, joint pain, or from co-occurring hypermobility, adding new levels of traumatic experience. And so all training is informative, effective, and evidence-based, and is centered around a truly trauma-informed approach. Next slide, please. Thank you. So understanding trauma calls for enabling the feeling of safety, of respect, and in building trusting relationships, building truly caring environments for individuals. It involves enabling soothing, finding ways to achieve self-regulation, of finding calmness and happiness again, and of finding best paths to healing. And it should consider sense making, making sense of what has happened and why it happened, as well as how to mitigate or manage it from happening again. And it involves identifying the best and most appropriate therapies possible for that child or young person. Next slide, please. Thank you. So in summary then, the aims of the NET programme are to portray and highlight that autistic lives are equally worth living and can be fulfilling and joyous. It fosters the real importance of collaborative, neurodivergent, affirmative and caring teams, which are built on mutual trust and respect, relationships, and above all, understanding. The use of the best of modern research, combined with autistic expertise and input, which is truly valued and listened to, informing excellent outcomes and enabling autistic people to live full and authentic lives. Thank you for listening, and I hope you enjoy the rest of the launch. And Georgia, back to you.
Thank you so much, Tristan. It is impossible not to consider staff well-being. Autistic people in these very moments of crisis, autistic people who potentially have lots of troubles with law, have done offences. That's why they have been involved in that system. Autistic people who have been suffering trauma at the moments of crisis, in the most difficult moments, they interact with staff that might not have a great understanding of autism, with staff that might be framing behaviors in a way that autistic behaviors are perceived as challenging. It is really, really important to support staff to create a low arousal environment, to create de-escalation strategies, and to be able to work in an environment where structure, positive aspirations, empathy, low arousal, and good links between professionals, between autistic and non-autistic people can be established. If you take part to our national pilot on the 27th of November, and not only you will have a chance to learn and to interact with our e-library and our curriculum and take that back to your colleagues, but also you will have a chance to help us get it right. We are learning so much from people like you who are into that workspace. So we very, very much value your feedback, and we will show you ways, in what ways we have incorporated that feedback as well for the next stage, which is our national rollout of the health and justice strand in January. As I said, professionals are also at the heart of what we do, and professionals do see the need for a different approach. Really, really happy to have Danielle Dunlop also contributing to our effort. So Danielle is one of the clinical staff and managers at Oasis Restore. Oasis is an organization that sits between the Department of Education and the Ministry of Justice, and they are the UK's first secure school. They hope, and they are doing it, they are replacing the youth jail with a quite innovative model that is bringing us more into the very values that Tristan explained earlier. But I think Danielle is going to do a better job than me explaining and telling us more about the model. Over to Danielle.
Thank you. Hi, everyone. So as Georgia just said, I'm Danielle Dunlop. I'm here from Oasis Restore. We are the UK's first secure school, and the hope, I think, is that we will eventually replace young offenders institutions as we know them. But at the moment, we are a proof of concept. So we're still in development, aiming to be open in spring next year. So we're registered, we're in a bit of a kind of a conundrum, I guess, because we're registered as a 16 to 19 academy, but we're also registered as a secure children's home. And the type of provision that we'll offer will probably replicate that more of a residential special school. So we're in a mix at the moment. We're in a ground between youth justice and education, but we're not funded by DfE at all. We're Ministry of Justice funded. So our overall vision is to create a therapeutic environment underpinned by the cornerstones, our 3 cornerstones of relationships, community, and discovery. And it's been so wonderful to hear this afternoon, everything that everybody has been speaking about just resonates so much with everything that we are trying to do, without knowing, I guess, that what we're doing is best practice, but it just reaffirms everything that we're trying to do. So thank you so much to everybody. Next slide, please. So we know from current data, although it is largely inconsistent across the youth estate, that the cohort of children coming to us will be largely neurodiverse. Lots of our children will have experienced school exclusion, and as a result may have experienced missed opportunities for diagnosis and therefore support. Our approach to inclusion at our school, and it will be considered a school, education is very much at the heart of what we're trying to do. It will be one of full inclusion. So we're looking at tailoring our environment as closely as possible to the individual strengths and aspirations of each individual child. We're not singling children out. We're not delivering ad hoc one-to-one interventions, but actually by the nature of how we've designed our environment, our curriculum, and the support, we're able to provide the safety and stability needed for our children to truly thrive in conditions and in environments where they used to not thrive, essentially. And at the moment, we know in the youth estate, children are not thriving, and reoffending rates are really, really high. We know there's a great need for educational staff and all staff across our establishment to gain a modern understanding about autism, beyond a disorder narrative, and understand how students perceive the world, what can help them regulate, and how staff can co-decide with students reasonable adjustments to prevent autistic burnout. It really takes trust and time for this to happen effectively, which is why relationships for us are so important in everything that we do. It's about changing mindsets and schemas for what professionals have learnt previously and adjusting that to what we know now, and how much better for the individual if we focus on their strengths and remaining curious about the parts of the day they might struggle with and how we can support with that. We wouldn't really be able to dig into the co-creation piece with our students if they don't feel safe, for one, and two, if we don't have the relationships with them. So we'll work really, really hard throughout the children's induction process to build those positive relationships. And part of our training model for all staff will be training into how to build relationships, because we understand that our staff will have different experiences themselves and come from lots of different backgrounds. Staff working with students 24/7, they'll be with them all day, every day, 365 days a year, if that's how long they're with us. For those children who have a history of behaviours of concern and or young offenders, although we're not calling them that in our environment, that staff may not always understand what drives student behaviour or the invisible stresses in the environment. This way, things may escalate. Understanding behaviour as a form of communication, and through the lens of discovery and curiosity, we begin to work out what the drivers are for this behaviour, where they've come from, and in doing that, we can change within ourselves as staff and our environment what we offer to them to make daily living and learning an experience that they are able to engage with in a positive way. We often hear from staff, this child doesn't engage or they're difficult to engage. But what we need to think about as staff is actually, what is it about what we're presenting to children that's difficult for them to engage with? So it's much more about, us as staff, what we can control and manage. We need to do that with the best interests of the children at heart. If we take the emotion out of responding to behaviours that can be challenging and violent sometimes, this takes practice and can be difficult. But if we do this and we approach behaviour with containment and curiosity, it's much easier to get the underlying messages behind the behaviour. This is really the root of what we want to know and what we want to support. However, it doesn't always work, and it can be difficult to implement. Many staff members have experience of parenting, education, their own lives, how they were brought up, that sometimes conflicts with the less punitive and more restorative approaches to behaviour. So it all feels a bit unnatural, even for those staff with the best intentions. I've heard the terms, and in my previous role, not in this role, but I've heard the terms, oh, we're just letting them get away with it. We need to do something about it. I've heard those kind of terms more times than I can count when discussing how we manage behaviours that challenge us. Add to that the very complex and threatening violent situations staff will encounter. These may engage their physiological responses, the staffs I mean, meaning that staffs themselves are not regulated enough to present as an attuned and co-regulating adult. This training offer will be crucial to giving our leaders and middle leaders the understanding and tools to be able to cascade the best practice. It also complements our ongoing staff support and development model. So we're able to look after our staff and to provide a space to take a deep look at ourselves as practitioners. We're offering fortnightly supervision and fortnightly reflective practice. So we can really delve deep into see where things are going well, and crucially, where we need to take a different approach as the adults who are supporting our children. We'll provide this all within a safe, open and transparent environment with the needs and experiences of our children at the heart of everything that we do. Staff have the best intentions, as we know, but may not always get it right. And it's our duty to offer high quality training. We're so pleased that this training is completely co-produced and co-delivered by autistic people and sometimes their family members too. This will give us a really unique opportunity for staff to engage with autistic narratives and understand the role that they can play in making a system less scary for students and their families. It also aligns with our co-production of those with lived experience in youth justice, and that's really something really important to us as we continue to develop. As a kind of startup organisation, we have a unique opportunity to be able to deliver staff training as a part of our onboarding of staff before children join us. So we should have a period of 6 to 8 weeks where we can just purely train our staff in our operation and our kind of culture. So what we're hoping to do is, by doing this, we have a much better chance of getting it right from the start and building that positive, inclusive school culture that we hope will provide a structure and a concept for other youth justice organisations to learn from. So we're really, really looking forward to being a part of this project. I can't wait for it to get started. What we're hoping to achieve from this is a gold standard of support and inclusion, not just for the youth justice and secure estate, but also for education more generally. So we're really able to meet the needs of all of our children, so they're understood and supported, and therefore much less likely to reoffend upon release, but also so that they are equipped with what they need in order to continue their education and training, or whatever they choose to do back within their communities that they return to. Thank you very much.
There is very, very little research about what autistic people go through and what do they need when they are involved in youth justice services. But we can imagine, and it has been recorded to an extent, how the stressful, loud, aggressive, chaotic, harmful environment of custody can trigger neurodivergent children. It can lead to behaviors which can result in them being labeled as complex, problematic, difficult, aggressive, and then that is activating a vicious circle of young people and members of staff being traumatized, being burned out, shut down, on a fight or on a flight mode. A recent National Autistic Society report on the experiences of autistic teenagers in the youth justice system in England has concluded that system-wide change is needed to address how autistic young people enter and are treated in the criminal justice system. I couldn't agree more with Danielle that staff want to get it right, and we see that with the professionals we're working with. However, to get it right, it is really important to understand in depth how autistic mind works, sensory communication issues, diagnostic issues, as well as post-diagnostic support. Our training is available to psychiatrists, nurses, people who work in custody, in prisons, with people up to the age of 25 years old, speech and language therapists, mental health nurses, occupational therapists, and so on. So how do we de-escalate? How do we get in charge of what we can control, our own behavior? We are excited to have Professor Andy McDonnell, who is a clinical psychologist, director at Studio 3 Training Systems and Clinical Services, and visiting professor at University of Birmingham. Andy, the last more than 20 years now, he has been publishing in the field of challenging behavior, low arousal, and de-escalation. Over to Andy.
Well, thank you, first of all, Georgia. That's a very kind introduction. I'm a clinical psychologist. For those of you who know about mine and my colleagues' work, I refer to myself as a psychologist, but probably also a campaigner. I spent my career trying to work on the eradication, not the reduction, of restrictive practices. And I'm really excited that we're involved with this national project. I think it's a really important development that we start to get true autism-informed knowledge that's based on co-production. It's just essential. It's not the answer on its own, but it's a really good building block. So my part about this programme, just some reflections really on the work we do. Some people will be familiar with the low arousal approach today. I'm not going to go through those kind of ground, but this is a reflection as a practitioner of some of the key things that we sometimes forget, particularly in residential schools and special schools as well. And one of the things I would start with, first of all, is that fear and stress permeates everything. Not just the fear of pupils, but their fear of us as well. And particularly with people with autistic experience, often describe this. And we know that some of the people that people support are traumatized by previous negative experiences. Quite often, most people who are traumatized feel out of control and have a need for control. Control is something that should be a battle between a pupil, an individual, and staff. It's not an idealistic statement. It's basic fundamentals of understanding trauma. You need a sense of control. We also know that from the evidence base and from experience that unpredictability of people we're supporting can also be an issue. Unpredictability of staff and pupils. So to create a safe and regulated environment requires us within a low arousal approach, not just to look at these micro skills, but also to look at our own behaviour. To give you an example about our own belief systems about behaviour, some estimates vary, but they kind of consistently come to around 60 to 70% of all behaviours are triggered by us, not the pupils, not the people with autism. And I think that figure should be quite damning for people when they reflect on these programmes. I've heard our colleagues today, some fantastic speakers. I don't want to list them all, but it's been really impressive to hear, and our last speaker as well, talking about reflective practice. It's the cornerstone of our work. We only learn by trying to prevent mistakes and try to understand that we are active participants in behaviours of concern. We are not passive observers, as some rather narrow behavioural models would have us believe. I think the other thing as well is that when we look at our own beliefs and this cocktail around low arousal, in residential settings, quite often the children, I'm very interested in our previous speaker, will develop reputations which quite often are not deserved. But it's very hard when you're a frontline member of staff or a teacher or a coordinator to not divorce that reputation and that fear from it. So I would like to use one part of that point to say is that in my work, fear is okay. Fear is an acceptable term. It's a term I'd like to hear more in supervision and other sessions from people, because sometimes we can be put in very fearful situations. I'm somebody who's jovially referred to as somebody from the University of Life. Some of the most fearful situations I've been in have been in care environments. So it's just a word when we're looking at this reflective apart to a low arousal approach, which is part of the programme and quite a cornerstone of it, is it requires us to reflect and think. And for participants on this programme, we're going to be encouraging even more active reflection, not just on best practice, but on some of our worst practices. That's how we've got to learn. Next slide, please. So, cornerstone again of our work is understanding. I've used the word autistic people in experience. I would not be as pejorative to have a license to claim that complexity that is autism. A colleague asked me recently, as a visiting professor of autism studies at Birmingham City University, do I like the title? And the answer is not particularly, because I think it's such an incredibly complex, entire chaotic subject matter. But there are some things that we do know from our evidence base, which is going to be in the programme around autism. My colleague Peter Moonen comes up with, for me, one of the best functional definitions around autistic experience, and also trauma too, it can be applied, which refers to chaos and uncertainty that can overwhelm people with stress and anxiety. Unpredictable, chaotic worlds where individuals are really, really struggling to regulate their own behaviour, and also other people may be struggling to regulate their behaviour with them. We also work with individuals who can mask this, particularly a lot of, not just exclusively young women on the spectrum, but where people appear to look calm, and then people use terms like explosive meltdown. I was talking to somebody recently who said that there was no triggers or antecedents to this young man's behaviour. He just blew up. My argument to that is there are a lot of these antecedents and triggers that are internal: stress, worry, fear, panic. You just don't see that. What you saw was the byproduct. And often when people are hard to read or judge, we often use these phrases a lot, using terms like meltdown and explosive meltdown, which again is some of the dialogue on this programme that people really, really will have time to reflect and talk about. We also know that people have very, very different coping strategies. Stress is quite an important term for that. I prefer to use the term stress rather than anxiety because stress is transactional in nature. We talk about stress being contagious. But actually, the most important thing with stress, which we're all exposed to, is our own coping strategies for coping with it. Some of us have adaptive coping strategies and some maladaptive coping strategies. And I'm not going to mention maladaptive coping strategies, such as a bottle of red wine, for example. Not good for your well-being long term, but it still could arguably be a coping strategy, just a negative one. I think the key thing about the low arousal approach I want to point out to is from my colleague Bo Elben, who is an amazing Swedish practitioner. If you ever get to read some of his work, which is quite a lot of it's written in English, Bo talks about emotional contagion as being important with the low arousal approach, that contagions are emotion, people's fears, their reputation, but also the chaos. And I'm quite interested that people that we support experience can also be contagious to us and vice versa. So part of this approach is a very positive approach to saying, a can do. If we can create a safe environment, people feeling safe, then learning and positive change can occur. Next slide, please. So I can keep coming back to this all the time. People think that low arousal is all about learning some techniques, how you stand, tricks about calm, reducing demands. All of these things are good things. But actually the core part of it is challenging our own belief systems. One of the core beliefs that I would put up here is that we have an interventionist culture. I put up here things like PBS and CBT. They're just other examples to be put there. I could even jest at psychotherapy as well. We try to have this fix-it culture where we want interventions to fix behaviours. And the problem is many of these models don't take into account the abuse of people who are autistic, and also the fact that in the neurodiverse world, people are different. They're not broken versions of us, to quote Jim Sinclair. So when we're looking at the low arousal approach, which is core to the National Autism Training Programme, we're going to focus on teachers and staff to really, really focus on their own behaviour and how they can create calm and regulated environments. And to create calm and regulated environments, it always starts with the first criterion, which is us, not them. Yeah. Some of those examples around these core beliefs need to be challenged. Yeah. All the time I hear in my job, somebody's doing it for attention. Somebody's doing this behaviour. It's what I call this nanny 911 culture. Most of this stuff doesn't reflect the complexity of the people that we're supporting. And actually, I think it's disrespectful to sometimes use simplistic explanations for people's behaviour, because simplistic explanations lead to simplistic interventions, such as conscious sanctions and other consequential-based interventions. So a big part of the low arousal approach is to learn techniques about keeping calm, regulated environments and co-regulation, but it is about changing cultures and changing cultures from the top down and the bottom up. We need to have shared belief in systems. A simple example is sometimes accepting that the person I'm supporting actually is quite complex, and that's okay as a word. It's not okay to oversimplify. It's better to actually acknowledge and embrace and accept that a person is different from me. And maybe I don't have a full understanding and never will of all the things that motivate their behaviour. Next slide, please. So really, the cornerstone of the whole low arousal approach is stress reduction. Stress reduction that's co-regulated. Sometimes we will do interventions with staff, teachers, pupils that really focus on their own reflection, their own regulation. Yeah? But there are other strategies that we mentioned in the programme that are evidence-based around the use of cardiac exercise for co-regulation, mindfulness-based strategies and other methods. But I think the key term, and I'm writing about this more recently, is it is about arousal regulation. Sometimes people misconstrue a low arousal approach as keeping everything quiet and calm and having no challenge for people. It's actually more about arousal regulation. And within that, it's about where our sweet spots are, because where we are regulated, we create things that actually are opportunities for learning. One of the analogies I'm using more recently is the Goldilocks zone. That's a phrase we use quite often for where we're looking for exoplanets. Where's the Goldilocks zone where planets may exist? Well, there's a Goldilocks zone that we start creating around arousal regulation. And that involves a collaborative approach to the fact that stress reduction isn't just for the people we support, but it's for us as too. Last slide, please. Thank you. So part of this whole bit and the excitement about being involved with this programme, and I am genuinely excited to be involved with this programme and honoured actually, to say the least, is that to create arousal and co-regulation, which has got to be central to the approach, we've got to consider that arousal regulation in teaching environments has to represent somebody's emotional state. To give you a good example, when is someone's sweet spot for learning? If you're someone that's a night owl, your optimum period for learning on average this is in the afternoons, not the mornings. If you're someone that gets up early in the morning and has a lot of sleep, your sweet spots are mid-morning. So we've got to use some of the science in that way to create these teaching environments that actually optimize success. And the other thing is to create this safe and small group opportunities for people to learn. I was actually recently at some schools overseas in Denmark where you either have one-to-one teaching or you have small, they are quite small classroom-based encounters. We're recommending that people have more dyads, where an autistic individual or young person can learn with another individual, almost as co-production role modelling. So we've actually put a separate stage in it. But I think overall for us, I would say that the challenges of this programme is it's long overdue and it's an exciting development. And I really, really, really do look forward to seeing what the learning and the outcomes are from this programme in the future. So thank you very much for allowing me the opportunity to speak today.
So how do we become more reflective? What do we do when we work with people who are completely dysregulated, who cannot put attention and effort in a moment of crisis to regulate themselves? Andy spoke about the importance of co-regulation and shifting into less punitive approaches. We don't want frontline staff to become autism experts, but we want them to become very, very confident into the ways that they control their own behavior, into the ways that they facilitate environments that are calm, healthy for staff, as well as the people under their care. If we go to the next slide, please. Next, we're going to hear from the National Autism Trainer Programme team, starting with Hannah MacDonald, our project manager at Anna Freud, who's going to talk about how do we get into the programme and what to expect. Over to you, Hannah.
Thank you so much, Georgia, and thank you to everyone else that's spoken today. It's been really interesting to hear from everyone and also really clear to see why this training is needed. And thank you everyone that's joined online today. It's really great to have you here. And we're really excited about, as Georgia said, the new pilot for health and justice streams. As Georgia introduced me, I'm just going to talk you through the practicalities around booking onto the health and justice Train the Trainer training with the National Autism Trainer Programme, what you can expect during the training, and then any additional support that you receive once you qualify as a trainer in your setting. If you have any questions whilst I'm speaking, please just pop them in the Q&A function and we'll try and get to them at the end of the webinar. So firstly, I'm just going to show you a quick animation that we've created. It's a training roadmap animation, which gives a brief overview of the journey that you'll take to become a National Autism Trainer Programme trainer in your setting.
What is the National Autism Trainer Programme? The National Autism Trainer Programme, commissioned by NHS England, is a train-the-trainer model delivered by Anna Freud and AT-Autism between 2023 and 2025. Is this training for me? If you are a support worker, team manager, psychiatrist, counsellor, nurse or any other mental health professional across England, working in any of these settings, this training is for you. Please make sure you book onto the correct setting. You will attend a 4-day online training course between 9 AM and 5 PM over 4 weeks, co-designed and co-delivered by autistic and non-autistic experts. What will I learn? You will gain an understanding of barriers experienced by autistic people through examples of innovative approaches of working with rather than on or for autistic individuals, including how to reduce restrictive practices. The training covers key approaches including a trauma-informed approach, an experience-sensitive approach and the SPELL framework. What can I expect if I sign up? Pre-training, you will complete a questionnaire to gauge your knowledge and understanding of autistic mental health. You must actively engage in all 4 training days and complete all reflection questionnaires throughout. You will be invited to join a community of practice to meet with other trainers, share your experiences and develop your training practice. You must attend all 4 training days to qualify as a trainer and gain access to the full multimedia e-library of educational material. I have qualified as a trainer. What now? You are now a trainer. Congratulations. You will be supported to co-deliver the training with autistic experts by experience and embed our approach in your own work setting. You will deliver a 3-day training at least once a year to help other staff reflect on their practice, enhance their understanding of the needs of autistic and neurodivergent patients and carry out their work more effectively. What ongoing support do I get? Optional additional days of training are available and you will continue to have access to our community of practice. How do I book? Book your training place now on our website. New training dates are released regularly. For any questions, contact natp@annafreud.org.
Thanks for that animation. I hope you enjoyed it. It just kind of gives a very nice overview of what the journey you'll take on the National Autism Trainer Programme. So as the animation mentioned, and also I think Tristan and Georgia also mentioned it, the training is 4 days across 4 weeks on the same day of the week. So we currently have 1 cohort available for the health and justice settings. And it starts on Monday, the 27th of November and continues every Monday until the 18th of December. And the training is 9 till 5 PM. I think my colleague has already dropped in the chat the link to book on this course, and we really encourage you to do so. So as soon as you've booked onto the training, you will receive a confirmation email from our system, so you know that you're booked on. You'll then receive an email from our lovely colleagues in our training team, and this will give you access to our online platform called Blackboard, and this just hosts the e-library of resources, and it's a one-stop shop where you can view all the training materials, your Zoom links and all the supporting materials that you'll need throughout the training course. You'll also be able to access it once you've completed the training as well. You'll also be given your login for evaluation platform, which is called POD, Patient Outcome Data, and I'll go into a bit more detail about that later. The final kind of part of the booking process is how many people from your setting should book on, and we really encourage around 3 to 4 people to book on from your setting so that you have peer support within your own organisation and provisions. This can be really helpful to disseminate learning, and it can really support you when you're delivering your training in your own setting. And quite importantly, it means that you and your colleagues have the opportunity to discuss the training and reflect on what it's really like to work in your workplace. So once you're booked onto the training, these are a few things that you can expect. So as I mentioned just then, the programme is evaluated using a platform called POD, and this really gathers real-time feedback whilst you complete the training. The first thing that we'll ask you to do is complete our pre-training questionnaire, and this must be completed before your first day of training. This is essential as we need to gather what your expectations of the training are and where you're positioned in relation to the content of the material that will be delivered to you. In addition to the pre-training questionnaire, you'll also have to complete a feedback questionnaire at the end of each day. This is also compulsory and must be completed at the end of day 1, day 2, etc., etc. This end of day reflective feedback survey, we just ask delegates to reflect on your learning of the day, and it just really forms part of your journey to becoming a National Autism Trainer Programme trainer. As Tristan mentioned, the training is fully delivered online and over Zoom, and a really key part of our training is that it's very interactive. So we want to create a safe space for all of our delegates. So we keep the cohorts relatively small at 23 people per cohort. You'll also be expected to fully participate in the training by having your camera on and join discussions and all breakout groups. We will have plenty of breaks to keep with the pace of the training, as we understand that breaks are needed so that you can fully engage. It's really important to note that this isn't a passive training opportunity. It is a train the trainer model, so you will be expected to deliver this training in your setting upon completion. So it's extremely important that you engage with all of the material. As Trista mentioned as well, all of our training is delivered by 2 trainers, and at least one of your trainers will be autistic, and sometimes both of them will be. This is a key part of the National Autism Trainer Programme, where everything is co-designed, co-produced and co-delivered by autistic people. And this means, as mentioned previously, that you will be expected to deliver the training in your setting with an autistic expert by experience. So that's what you can expect during the training. And how do you qualify as a trainer? So as it was quite nicely summed up in the animation, you'll need to attend all 4 days of training, engage with the material and complete the reflective feedback and the pre-training questionnaire. We do understand, and I know it was mentioned in the Q&A a bit earlier, that work commitments and unforeseen circumstances can crop up whilst you're taking the training, and you may not be able to complete one of the days of training. If this is the case, in the first instance, please email our training team, and they will review your case. So we'll be able to review on a case-by-case basis. We will make our best efforts to accommodate you so that you do complete the training and become a National Autism Trainer Programme trainer. But as I say, we will review this, and it's just important you let us know as soon as possible. In order to maintain your National Autism Trainer Programme qualified trainer status, you will be expected to deliver a 3-day training once per year in your setting with an expert by experience. As I mentioned earlier, you'll have access to Blackboard after you've completed the training, and on this will sit the 3-day training that you need to deliver, along with the facilitator notes and a training companion brochure, which gives you information about how to deliver the training in your setting and practical guidance on working with experts by experience. I know it was also mentioned in the Q&A a bit earlier as well, but we have a pool of experts by experience that work within the National Autism Training Programme, and you can get in touch with us to book one of our EBEs to deliver with you, and we can put you in touch with them. However, if you already have an expert by experience in your setting and you would like them to become the co-trainer, then you can contact us at National Autism Trainer Programme. NATP at annafreud.org, and we can arrange the training specifically for experts by experience. If you also are an expert by experience and would like in your setting and would like to deliver the training, please also email us at natp at annafreud.org so that we can set up this training. Finally, I just want to briefly touch on the support that we offer to qualified trainers, as it will be mentioned in more detail by my colleague Ruth shortly, and has also been briefly mentioned by Tristan earlier. So we have specialist trainer days that will run a couple of days a month, and they will consist of a day of training with external speakers, and it will be really focused on specific themes like autism and ethnicity, suicide and autism, etc., etc. These are additional and unique learning opportunities on top of the training, and you'll gain knowledge from experts in the field. The other thing we offer is one-to-ones with the directors of the National Autism Trainer Programme, so Georgia, who's been excellently chairing this meeting, and Ruth, who you'll hear from shortly. If you have any practical queries or require any support on top of the training that's offered, they will really help with talking you through contextualizing the training material for your particular setting and any other questions and support that you need. Finally, we have the community of practice, which is ongoing and is a growing community. Everyone that's completed the training is welcome and encouraged to attend all community of practice events so that you have the opportunity to interact with your peers and hear about and discuss practical strategies when it comes to co-delivering the training in your setting. So thank you so much for listening to me today. I have my colleague will, oh, sorry about that. My colleague will put the link to our newsletter in the chat so that you can keep up to date with the programme, and any questions, please email us at natp@annafreud.org, and I'll pass back to Georgia and Ruth. Thank you.
Thanks, Hannah. So I'm going to do a very quick whistle-stop tour of the community of practice. Is that okay, Georgia, if I just go straight into it, very aware of time? So my name is Ruth Moyse. I'm the co-director of the National Autism Trainer Programme alongside my colleague Georgia Pavlopoulou, and I represent AT-Autism here today. I'm also standing in for Chris Atkins, who runs the community of practice for us, who unfortunately is unexpectedly not able to attend today. Next slide, please. So once you have completed your training, there is a range of support, as Anna has mentioned, available to National Autism Trainer Programme trainers. And this is headed up by the community of practice, which offers various specialised activities and events intended to consolidate and enhance your learning and practical skills related to training delivery. And this is really important because we recognise that as good as this training is, and we like to think that it is training that you will enjoy and feel involved in, and it's excellent opportunities for you to reflect and share good practice. Training on its own is not enough. We need to maintain our learning and our experiences, and we need to share that good practice with our colleagues. So the community of practice is an essential component of this programme. In addition to that, shared learning experience seminars focus on particular knowledge and particular understanding, help to build expertise in particular areas, or give you the opportunity to learn about a particular interest in more depth than we can perhaps cover it in the standard 4-day course. Next slide, please, Hannah. So we can arrange specialist days in response to specific requests. If we hear delegates asking for particular areas, such as on disordered eating, for example, that we need to do more of, then we can actually put on those specialist days to meet that need. So do, in your community of practice, do forward that information to whoever is running that on the day. And one-to-one support, as Hannah has already mentioned, always available to you as well. Next slide, please. So what is a community of practice? Well, fundamentally, it's just a group of people who share a concern or a set of problems or a passion for a topic, and who seek to deepen their knowledge and expertise in this area by interacting on an ongoing basis. And it's that ongoing basis so important here. It's a process. It's not an end point. It's something we're doing together to move forwards and to continually aim to improve our practice and to learn from each other. And that, of course, for us means supporting those of you who have completed the National Autism Trainer Programme Train the Trainer course. Next slide, please. The concept of a community of practice revolves around the idea that learning and knowledge creation are social processes. So it's for that reason that our training does involve participation and engagement. It's certainly not something you can come along to and just receive information. We're actively wanting you to engage and participate and share ideas and share your learning with us. And that's something that we aim to maintain and continue through the community of practice events that we will plan and deliver with you. So these groups of people come together to learn from each other, share experiences, and collectively develop a shared understanding of their field. Next slide, please. So to be able to do this effectively, we have to be led by members of the community, by you, people who hopefully will complete the National Autism Trainer Programme. And we'll support you too in all of the different areas or any challenges you experience or particular topics that you want to hear more about, so that you can deliver the programme effectively and confidently to your colleagues. Next slide, please. Yes, effective community practices take time and commitment, but one of the benefits is that hopefully by attending, you will feel more confident, you will be enthused, you'll be joining a group of people who have the same aims and intentions and desire to improve practice moving forwards. So hopefully you will all become active members and benefit from the experience and expertise of others, as well as contributing your own skills, knowledge and understanding to the rest of the community. All sorts of different events and activities that we can plan with you, for example, talking about producing leaflets and flyers to make the programme visible in your service, engaging with current, more experienced trainers, so getting ideas and tips about what works, what's great, what not to do, and thinking about self-reflection. What is the impact of my own behaviour on my practice? What can I learn from colleagues? What can I learn from other trainers? And thinking about ways of engaging with colleagues that you are training to really lock down their interest. Next slide, please. So the shared learning experience seminars, they will be themed and they'll be available to everyone who registers with the programme. Next slide, please. And they build on the core values of the programme and the approaches that you've heard something about already today. And they include presentations by leading experts in the field. Yes, that's fine. Thanks, Hannah. And all of it will be available. If you're not able to attend on the day, then please stay in touch with us. Lots of resources will be available on our learning platform to review at a later date. So some examples of shared learning experience seminars we've delivered to date: camouflaging and masking by some experts in the field, Dr. Amy Pearson and Kieran Rose, as well as trauma, dimensions of wellbeing, and a relational approach. Next slide, please. So these specialist days, these will be established in addition to the courses, in addition to community of practice events, and they're an opportunity to look more in depth at a particular topic, to something that's not included in as much detail on the course. Next slide, please. And some topics for future specialist days include family-centred approaches, how to audit your setting using the framework that we use on the programme, the SPELL framework, autism, ethnicity and culture, and using an intersectional lens when we're delivering our material, and thinking about the importance of staff wellbeing, because we all know that staff wellbeing leads to staff well-doing. Next slide, please. So in summary, please come and join the training, meet other colleagues, meet other people in similar settings, and engage in this training with us. But after that, you're not left on your own. We're here for you every step of the way with different events to work with you as you gain in confidence and as you share your good practice between and amongst yourselves. So together we'll influence, hopefully, others to promote positive, meaningful change in the experiences of autistic people throughout all sorts of different settings and mental health services. Thank you. So that's a very brief, quick whiz through the community of practice. We're now going to move to a question and answer session. We have got a few people who are going to put their cameras on now who will be able to answer some of the questions that have been coming in as we've been listening today. If I can ask Hasan as well to put his camera on, and also maybe Scarlett and Vanessa, that would be lovely. Thank you. So first question, probably to Hasan actually, and Scarlett. Is this training also being rolled out to the police? I think that we would be keen to deliver the training to our liaison and diversion teams as well as custody staff. Scarlett, you're nodding. Would you like to take that?
So at the moment, we're not commissioned to roll it out across the police, but it's absolutely something that we can ask if they'd be interested in, and I can take that back to Andrew to have the conversation with his contacts over in the police force. But it is open to liaison and diversion services. I think there was another question about the SARCs. It is open to SARCs. So at this point, no, not open to the police, but fingers crossed. We'll see what we can do.
Thanks very much. Hasan, did you want to add to that?
I think it's just important to understand sometimes that this is a train the trainer program as such. So we're expecting the trainers to come from the services that are being commissioned through us. But if the trainers are then in their settings delivering it to other individuals as part of the wider teams, then I don't think that's an issue as such. But it's the trainers themselves that need to come from those settings.
Perfect, thank you. Do we need to use experts by experience from your pool rather than use our own? And how do you count autistic professional trainers who can be an autistic clinician, for example? Georgia, would you like to take that one?
Yeah, thank you. Very good point. You can work with your own experts by experience. We will offer them training, and we will offer them the opportunity not only to become NATP certified, but also to grow their competencies and their skills. EBs also have their own community of practice with us. They attend impact seminars, specialist seminars. So we're really happy to upskill and certify your own EBs. Very good point. What do we call expert by experience? That's something we have lots of discussions in our teams, because most of us are neurodivergent and we hold many identities, clinical, academic identities. Some are parents also of autistic people, and so on. I think it is really important to send your autistic colleagues to come to the training. They will feel validated. They will offer a lot to the discussions and conversations, and they will most probably be excellent trainers as well. It is important, though, to also have colleagues who are not into the front line or clinical profession, so that you can hear from people who, experts by experience, who might had been into the criminal justice system as service users, because they can also bring lots of different perspectives, not being professionals in that sense, if it makes sense.
Thanks, Georgia. And I think that's one of the most powerful things actually about the programme. When, as Hasan said, it's a train the trainer programme. When delegates who are trained by us go out and co-deliver with an EBE, it's often that co-trainer who's delivering alongside a colleague within the service that actually provides some of the most meaningful input in a way that hasn't been heard before, because they're delivering and facilitating conversations and able to bring in their own knowledge and experience. Next question. Great to hear that staff working in health and justice commission services will have access. My understanding was that it was for the children and young people's secure estate, but not yet for adult secure services. Can you confirm that currently it is only specific parts of the health and justice portfolio? I'm going to go to Hasan for this one, I think.
Probably best answer through Scarlett, but I can add to that if it needs to be.
Yeah, so for now, it's through health and justice services that are commissioned through health and justice services, although SARCs, not SARCs, there are a couple of services that aren't directly commissioned that are able to access. At the moment, the focus is on children and young people, but the ambition is that this rolls out to be all age in the not too distant future.
Thanks very much, both. Next question is for Vanessa, please. I'd like to hear from an autistic person in the group. What is the one thing they hope staff can get from this training?
I suppose honesty. We just say it as it is. We don't filter what we say. I think that's I can say it in a nutshell. All our experiences are very different. So my lived experience as a Black autistic person, late diagnosed, is very different to like Lauren getting diagnosed at 26. So you see two different stories, but we still sort of experience the same challenges being Black autistic people. But I think for me, it's just making sure that autistic voices are heard, because I look at my daughter who's 17, and what she's gone through being in the mainstream college, which she wished she never did, was being misunderstood. Now she's gone into shutdown. So it's making sure professionals understand what autism is and not what they make the assumptions are.
Thank you very much, Vanessa. Next question. Does a justice setting count as a community-based youth justice service? Scarlett. guessing that's for you. You're nodding.
Yes.
Okay, thank you. Are there any plans for shorter courses? 3 days. The question says 3 days. It's actually 4 days. It's a big commitment and a busy service. Georgia.
Let's see what the pilot is going to show. We will definitely have master classes and specialist days, but we need to see, before we can answer that, we need to see how the pilot is going to work. And we're very open to feedback and to reevaluate.
Okay, thank you very much, Georgia. Okay, so very conscious. Oh, Hasan, yes, please.
Right, just really quickly, I think the reference might have been to the training back in the settings being 3 days that the trainer then delivers.
Oh, sorry, yes, sorry.
Yeah, okay. And again, just on that, I think it's quite flexible in terms of the delivery back. It doesn't have to be 3 back-to-back days. It depends upon how the service operates, etc. So there is a lot of flexibility in how they can deliver the course back in their settings as well.
Thank you so much. Just to add that people can break it into different sessions as long as they keep the fidelity and the order. You can run 1 hour per week in your meetings, or you can do half days and so on. Once you are not qualified, you will receive the training companion, and in that companion we give you lots of ideas on how to break it down in a way that it works for you. You can take up to 6 months or the whole year to go through all sessions.
Absolutely, and the community of practice again is a place where you can go to discuss these sorts of things, how to make it work best in your service to your colleagues. Very conscious of time. I know we haven't got through all of the questions, but what we will do is take them away and we'll answer them on text and make sure that they get sent out to you, if that's all right with everyone. I'm going to hand back to you now, George, to wrap up, because I know we're very close to the end time. Thank you.
Thank you so much. Yeah, I was distracted from the Q&A. It's really nice to see many really good questions. As Ruth said, you will hear in the next few weeks, you will get a copy of our slides, all the questions and so on. Really, a very warm thank you. Thanks to our contributors. Thanks to the people who have been attending today and asking really good questions. We are really looking forward to welcome you into the pilot, and after the pilot to the national rollout. We hope that we can give you the knowledge, the skills, the confidence and the inspiration to become agents of change in your services. We do know that autistic people suffer more mental health problems. They are overly represented in criminal justice. They often don't have a good transition back to the community. They stay much longer into the system. We want to change everybody.